Welcome to another episode of the Your Company Health Podcast. My name is Andre Wright, and today we have a very special guest. Today we have Dr. Eboni Haynes. The doctor is a public health professional. She's currently a health science director at Virginia Union University and also adjunct professor at University of South Carolina. Welcome, doctor, and how are you?
I'm well, thanks. How are you?
Doing well. I'm so happy that you joined us today to share your knowledge and your journey. So to get things going, I wanted to tell us about your background and how you started in public health.
Oh, wow. That's a loaded question. I'll try to keep it succinct for sure. So thanks for having me on. A little bit about me. So I actually started out my public health work while I was still in college. I actually attended Virginia Union University as an undergrad. And while I was there as a student, I was a biology major, and I had the good fortune of connecting with a nonprofit organization in the local community that was doing HIV/AIDS, STD prevention work in high-risk communities across the city. So I had a chance to work specifically with middle schoolers, high schoolers, young adults in low-income housing developments, also in juvenile detention facilities, community centers, boys and girls clubs, those kinds of places, but also young adults who were in prison in the metro area. And so I did that work for a while. I worked for the state health department for a while. And then I got an amazing opportunity to move to Pennsylvania and work for a national nonprofit organization doing sexual violence prevention work on a national scale, developing social marketing campaigns around sexual violence. And that was an opportunity for me to really help the organization diversify its messaging so that it could reach a broader audience, particularly a more minority audience. I eventually transitioned into state government. I worked first as an EEO officer for one of the state agencies, but then transitioned into a position where I was helping another agency transition individuals with disabilities and older individuals out of mental institutions and nursing homes and into community-based living in the community with the supportive services that they needed. And did a lot of other work in terms of changing policy in state government as it related to supplier diversity, but also did some work centered around improving policies to make more housing units available for people with disabilities through the low-income housing tax credit program. Eventually, I worked as a grants manager for the city, got recruited to work for a health system in the Lancaster County area of the state, worked in community health, particularly with policy change, working with municipal leaders, school superintendents, business owners, the chamber, and a number of other organizations to help them change policy to improve the health of their constituents, whoever those constituents might have been, and eventually transitioned to a role very similar in Birmingham, Alabama, with University of Alabama at Birmingham, doing that work centered in Birmingham, but also in Mississippi. And so all of those experiences kind of culminated into, I need to share this knowledge and all of this amazing understanding that I've gained along the way about how you do this community-based work, how do you do community-based participatory research work on the ground, and so that students would, be able to benefit from that and take those best practices with them as they ventured out into the new world of public health. So that's me in a nutshell.
And that's perfect, and a vast background indeed. So, most times I speak with healthcare professionals, there's always this aha moment. So I wanted to tell our audience, how did you become interested in this field? And the part two, do you feel the same way today or have the same
Okay, yeah. So that's an excellent question. It's actually the answer I actually give my students during the first week of all my classes. So what really got me into what I now know as public health is, I had this interest in epidemiology and viruses and tracking viruses because of a book called The Hot Zone by Richard
Mm.
Preston. When I was in high school, I read that book. It was about a fictitious Ebola outbreak in the United States. And I'm like, yes, this is what I have to do with my life. And I always tell students, always do internships because they will let you know, what you enjoy and what you don't enjoy. And so I had an opportunity to do an internship, and I loved the internship. It was at the University of Iowa, and I worked with an amazing researcher there. But I learned that although I loved every aspect of the lab, I love running gel electrophoresis, I love, studying, the bacteriophages. I just did not like the lab environment because it really just did not fit with my personality. You probably figured I love to talk to people. I like to engage. And that's not really what you do in a lab environment, at least most of the ones that I was exposed to early on. So I learned that I needed to figure out how I could do that work addressing infectious diseases, but do it in a way that really did align with my personality and, just kind of how I wanted to show up at work every day. And so I ended up working, like I mentioned, with that community-based organization, and it gave me an opportunity to know way more about all of the sexually transmitted infections than anyone would really want to know. But I got to translate that very scientific knowledge to communities of color and other more, disadvantaged communities so that they could understand it and take that knowledge back to the people in their, spheres of influence. And that's what we encouraged them to do, whether it was the kids, the young people I was working with in juvenile detention, or people who were getting ready to be released from incarceration. The goal was to make sure that they could communicate effectively with the people in their lives to help stop the spread of sexually transmitted infections. And so, yes, I'm very much still excited about that work and passionate about that work. My focus has shifted just a little bit, though, more into the policy space, because just in policy, you get to impact more lives, and into the teaching space where you get to teach the next generation about how do you do this work in public health in a culturally appropriate way. So it's more than just using the right words when you're going out into a community and giving, the community members this information in layman's terms so that they can communicate it to other people, but also how do you speak this language in a way that minority communities receive it and they internalize it and they recognize that there is some responsibility too that they have in making sure that that information is transmitted in appropriate ways to their communities. And that's kind of our tradition, right? That oral history that's passed down. We can do the same thing in a public health space. We just have to be intentional about it. And we have to make sure we're training people in using that culturally appropriate language and doing the work of public health or in healthcare in very culturally appropriate ways.
Right, and that's perfect. And Doctor, we know that minorities are affected much by public health. What are some of the programs that you have worked with and you're working at this point to help minorities and help that area?
Absolutely. So the major program that I'm working on right now is actually a program that's funded by the Health Resources and Services Administration's federal agency that's focused on the development of a competent healthcare workforce in the United States. And through HRSA, we've received an almost $10 million grant in order to increase the workforce that is focused on COVID-19 education and getting people vaccinated. And so I work through an organization called Ashland Management Group, does a wonderful job in making information available through its digital learning platforms and training development, but also it's focused on small businesses and minority-owned businesses. But we do that work in partnership with Morehouse School of Medicine and Meharry Medical College, who are both working to train community health workers and health outreach workers so that they can do that work that I was mentioning earlier, getting out into local communities and sharing that knowledge, particularly in minority communities whom we know are most impacted by COVID-19. We have certain segments of Black and Brown communities that, particularly college age students, who don't feel the need to get vaccinated. They don't feel that they know enough about the COVID vaccine. They don't feel like that if they were infected with COVID, that it would have long-term consequences for them. And we all know that that's not the case. We have long haulers, what we call folks who have long-term consequences from a COVID-19 infection, right? And so we have a group of college ambassadors who are working to educate that group specifically using social media and other means. For example, they use TikTok videos as a way to spread the news among that college age group. But then we also have community members, folks who are just interested in sharing information with their local communities, who go out into communities in Georgia and across Tennessee and share this knowledge. They work to get people vaccinated. And then we have a third group of individuals, which is the group that we are focused on over in my camp. And those are the small business health ambassadors. We call the small and minority owned businesses that have come into our fold and said, I want to be an advocate for community health in my local community. So I want to be trained so that I know what to tell people. I need to know what to tell my employees as it relates to COVID-19. And so we've trained over 240 individuals as small business health ambassadors, and those folks are getting the word out in their businesses. They're getting the word out in their local communities. They're organizing vaccination drives within their local communities because they understand how important it is not only for them to have a healthy workforce, but also to make sure that the community in which their workforce lives is healthy. And we are incredibly proud to be able to do that work because most public health work is not really focused on business engagement in, as part of the frontline defense and public health. And so we're showing that these small businesses and these minority owned businesses really do want to be part of the public health response, whether it's COVID-19, whether it's monkeypox or anything else that comes down the pipeline. They want to be part of that work. And so we're working to make sure that in the future, government agencies see them as part of that public health response.
And that's great, Doctor. And again, thank you for what you're doing in the communities to make it better. And I know this is your passion in terms of the pandemic and COVID-19, monkeypox. That's your wheelhouse. But how has the pandemic impacted public health and even your role?
Absolutely. So, that's a loaded question because the pandemic has impacted the field in so many ways. For example, with health communications, I think that was one area where, yes, in public health, we have for a long time, sent communications out into communities and encourage people to, do those healthy things that we want them to do, things that are going to prolong their lives. But COVID-19, because of how quickly it came onto the scene and how quickly it disrupted our economy, it disrupted people's lives. It literally early in the pandemic, people would get a COVID infection and go into the hospital, and so many people were dying so quickly that I think for the public health field, it raised this awareness, it heightened this awareness that our health communications campaigns are not meeting the mark. They are not getting out quick enough. They are not being developed in as culturally appropriate ways as they should. Our messaging sometimes doesn't resonate with certain members of the community. And although that has always been the case, because of how quickly COVID, came onto the scene, I think it really raised the awareness that we need to do something about this right now. And so you see the government and other organizations, nonprofit organizations in particular, funding efforts to make sure that the workforce that is developing messaging, the workforce that's going out there and doing contact tracing, is representative of the communities that are impacted the most. And so that's one way that the field has changed. Another area that we've seen as a result of COVID-19 have marked shifts is the enrollment of students in public health training programs, whether those are bachelor's programs or master's programs. Because of the COVID-19 pandemic, universities saw huge upticks in their enrollments in those programs. And those enrollments were pretty diverse, right? More diverse than we've seen in previous years. And I think that that's a indirect correlation to the fact that so many communities of color were impacted in worse ways by COVID-19, that younger individuals, said, I need to do something. I want to address health disparities in my local community, since health disparities and health inequities became very much part of the conversation in the news and in other areas. So those are two major shifts that we've seen. And so now the challenge is going to be making sure that we sustain those jobs, right? So now we don't have the need necessarily for as many contact tracers that got hired during the pandemic. So now that we have all of these new students, these graduates coming out into the workforce, where are they going to work? How are they going to use the skills that they've developed through their training programs and through their work as contact tracers to translate into real meaningful roles in the public health space where they are able to do real health equity work? Right, make impacts, and where their recommendations on improving programs is not going to fall on deaf ears, but actually be incorporated into the work that they're doing. And so in as it relates to me personally, in terms of COVID, probably the biggest change is that I just had a lot more speaking engagements around public health, whether it was at my church or somewhere else. There was just this interest in, having people who look like the communities that are being most impacted, sharing information, putting knowledge out there to communities of color in ways that they could understand. So I probably had more speaking engagements during COVID on an infectious disease related topic than anything else. But I will say, on a more serious note, that COVID has impacted my family as well, like seriously. So during COVID, my youngest son, who was getting ready to complete high school, was in a phase where, he and his friends felt like they were invincible from getting COVID-19. And during that period, my mother-in-law was living with us, and she is a cancer survivor, immunocompromised, in her late 80s. And so there was a very real need for us to make sure that our bubble stayed intact, to protect her and to protect ourselves as well, but particularly her, since she had a very, she was immunocompromised, like I mentioned. And it was just that peer influence is so strong that, my son felt like he could go out and he could hang out with his friends, no mask, come back home and, think that everything was okay. And it really wasn't. And so sometimes we don't talk about some of those challenges that families are experiencing when you have individuals who don't believe in vaccines or who feel like, they're invincible. But we ended up having to tell my son that he had to go live somewhere else if he was not going to abide by the rules that we established in our house, because we have a responsibility to protect each other. Right. And so as a mom, it was the hardest thing I've ever done, hardest thing by far I've ever done. But at the same time, as a public health professional, again, we have a responsibility to not only our families, but the communities that we serve to do the right thing, to make sure that we're promoting positive and healthy practices, to be an example to others. And so, it was just one of those things that we had to do. And also the responsible thing to do as parents, right? Because there are consequences, and we have to make sure that our children recognize that there are those consequences. But I will say one of the things I do wish that we did more as public health professionals is really talk about some of those ancillary things that have happened in families and in communities that don't get the attention that they deserve, because these are very real issues that families are grappling with or had to grapple with during COVID-19. And we had a few TV shows and that I'll mention, like Queen Sugar did a really good job of really expressing some of the challenges that people were dealing with through the pandemic, and just trying to keep people safe, and what families, the challenges families had to work through. Same thing with a TV show called P-Valley, where they talk very seriously about the impact of COVID-19 on families and those decisions that families had to make and businesses had to make. And there are lots of other like your traditional shows, New Amsterdam and ER, all of those shows, they typically do those things, right? Or Grey's Anatomy, not ER, but that's normal for them, right? To tackle health issues. But for those other TV programs, we needed to see those images so that we could have those conversations within families and in communities. But I'd like for us to see us do more of that moving forward, and engaging other voices that traditionally are not included in this public health space.
Well said, Doctor. And as you clearly articulated, there are a lot of issues, around the pandemic and these diseases. But I want you to talk to us about telehealth. How can not only providers but institutions use telehealth to advance public health?
Yeah, that's a great question. I think one of the other great things that came out of the pandemic was that providers were in many ways forced to move into the telehealth space when they had been very slow to do so for good reasons, right? They were trying to work through challenges related to security, and internet security is a big deal, right? And it's nothing to take lightly. So they were slow to move for good reasons. But they needed to have moved a long time ago, because we know that there are communities, for example, rural communities, that often don't have specialists there. And so having access to telehealth services, even if it is at the only hospital that's in that rural community, would make a big difference in improving health outcomes and reducing health disparities and health inequities that we see in communities all across the country, not just in rural communities. We see that, for a while, before COVID happened, we saw the VA hospitals really doing a good job in rolling out, particularly mental health telehealth services, right? But we didn't see that same push for telehealth services in the mental health space really until COVID hit. And we realized that people were struggling with being isolated and not having people to talk to, not going to work, or being in a situation where now they were at home with someone who may have been abusive, right? And so in the telehealth space, as it relates to mental health, now we see a whole lot of providers who are offering it. But in the other areas of healthcare, we see telehealth rolling out. We see telehealth has made its way into the patient portals. And so now through your patient portal, you can schedule appointments with your doctors and meet with your doctors through that portal that was already there, probably for many providers. And so it has, COVID has really been a catalyst for moving that very necessary work forward. So we're really excited about that. But there's a long way we still have to go, right? We recognize that with the mobile technologies that are out there, we need to make sure that our healthcare providers are tapped in and that they can connect with people wherever they are on whatever mobile devices they have access to, but not at the expense of making sure that we are training our healthcare professionals, making sure that we are diversifying our healthcare workforce, making sure that we have culturally competent providers out there providing the types of help that those individuals need, and using the technology to complement what's happening at the bedside and in local communities, whether those are with medical healthcare providers, MDs, nurses, or whether it's with community health workers who have received specific training to provide certain services to communities that can, for sure, reduce health disparities and improve health equity across the board.
Well said, well said. And Doctor, that's one of the things that we do with our company, helping healthcare practitioners to get their digital marketing, in the right place and be able to serve their patients the best way. But I want to talk to us about some misconceptions with a healthcare, a public health professional. What are some misconceptions out there?
Okay, so that's a really good question, because my students are always blown away when I say that there are thousands of job types out there in the public health space. And they, often look at me and say, what? Really? I only know about epidemiologists and health educators and biostatisticians and, professors. I didn't know you could do all of these other things in public health. And so I would say that's probably the biggest misconception. I talk to a lot of students who say, I want to go into epidemiology, because they were just like me. They read a book, they thought chasing viruses was great. And they, the only way they knew to do that was through epidemiology. And so, having students really spend time understanding career options, understanding career clusters, and how you can combine clusters to create careers or to go after a career that really already exists. Maybe it just hasn't been well marketed, right? And maybe you only need a little bit of additional training, and maybe you don't have to go back to school. You just need to shadow somebody. Yeah. A lot of times our students, and public health is no different than other industries in that way. We just need to make sure that we're telling students that all of these career opportunities are available to them, and that they need to align their career interests with their personal passions, with their personalities, with the populations that they are really motivated to serve, and know that they can serve well. So that's probably the biggest misconception about public health. Maybe one of the other misconceptions about public health is that, if you go into public health, you won't make any money. Right. It's almost likened to, you going to be a school teacher, which I also feel like our school teachers need to be making way more money than they do. Right. But in some areas of public health, in some states, states that don't value public health as much as other states, the profession of public health, you probably aren't going to make as much money. Or if you're in a poorer state, you're probably not going to make as much money in the field as maybe someone who's working in a state where they really value public health professionals and they provide them the resources and the training and, free reign to really go out there and be creative in how they address public health issues within their local communities. So don't feel like if you go into public health, there aren't opportunities for you to, what I call, make a decent living. You have a living wage or better. And you just have to make sure that you are preparing yourself. You're out there getting experiences that you can put on your resume to make sure that you are marketable for those jobs that do pay a little bit more in the public health space. And then finally, I would say one of the other misconceptions about public health is that it's an oversaturated field. And it really isn't. Some people feel like, especially here, I'm in the Atlanta metro area. And so people feel that, I can't get a job in public health. But the reason why you probably have a harder time getting a job in public health is because here in Atlanta, we have a lot of schools of public health. The CDC is here. And so everyone, it seems like, who has a degree in public health wants to move to the Atlanta area to be closer to CDC or other contractors who might have more job opportunities available to you. So maybe here in this area, there is an oversaturation of public health professionals. But in other areas, there is a lack of public health professionals. And they are doing everything that they can to recruit people from other states in order to fill those roles. And so I would encourage individuals who are in this space to be open to opportunities and be willing to move, especially if these organizations are paying you to move, to take this job, because you might find that there is a wonderful opportunity out there that really aligns with all of those things that I mentioned before, where you can make a huge impact and build your resume so that you can go somewhere else, but you might actually find that you love that community that you're in and you want to continue serving it. And you probably will be one of the best people to do it because you bring something that nobody else brings to that role. So be encouraged to look at opportunities in other communities.
Well said, Doctor. So many gems and great advice that you've been putting out there, and I know our audience are enjoying what you've been talking about. So I want to speed up a little bit. If you could rewind, say, your career path, is there anything you would have done a little bit differently?
That's a great question. Generally, I say no, because I feel like all of us have a path that we're on that really, if we're smart and if we're paying attention, we see later how all of those experiences have culminated in making us who we are and allowing us the opportunities that we move into. But I will say, I knew when I moved to Pennsylvania that I was interested in getting my master's degree and pursuing a public PhD in public health. And when I moved to Pennsylvania, I moved to an area of the state that had no schools of public health. And so I had to make a decision about what my educational opportunities would look like living in that part of the state. I would have had to take the train 3 hours to get to Pittsburgh. I would have had to take the train an hour and a half to get to the Philly area to get to a school of public health. And so that probably would be something that I would do a little bit differently. I probably would have had to negotiate in terms of my job just to make sure that I was positioned so that I would be able to take advantage of my schooling at that point in my life when I really had hoped to do it. But putting it off actually did not hurt at all. And actually, I feel like it made me a better student when I went into my PhD program, because by then I had developed experience working in local government, state government. I worked in a healthcare system. And so by the time I got to my PhD program, I had all this knowledge about how all these systems work and don't work together, that I was able to really input into my studies, into the things that I was reading, the things that I was writing. And so it all worked out the way, like I say, the way it was supposed to. But if I could have done something differently, I would have paid attention to that desire in my heart to pursue higher level graduate education in public health, and then positioned myself in a much better way so that I could go after that at that point in my life.
Yeah. Well said, Doctor. Well said. I want you to tell us. I know you spoke about some issues or the negatives in public health, and also the positives. But I want you to just talk to us about, where do you see public health in 5 years? The direction. What's the trajectory? What do you see next 5 years?
Yeah. So a lot of the work of public health is driven by our government. unfortunately is the way it is. And so what that means is that our government, our legislators establish the budget, right? The congressional budget, that's the budget that the state agencies have to operate from. And so the funding that is allocated to all of those agencies, those federal agencies for public health projects, really becomes the agenda during that time for public health. And so you usually can see what the government's priorities are just by looking at the federal budget. That might be something else people don't realize, but a misconception maybe. At the same time, though, you can say the same thing for state governments, right? So the money that they're putting forward for public health programming is really establishing the priorities at the state level as well. And so that the best opportunities for us to change that is through advocacy work. And so all of us have an opportunity to contribute to, the establishment of those priorities by calling our elected officials and telling them what's important to us, whether that's on the state level or the federal level, so that they can take that into the meetings that they have, when the budget meetings that they're having, and establishing the priorities for all of these health and human services agencies. And so I think that for those individuals who kind of are savvy to, how the budget process works, they are already doing that work. And so, what I see on the horizon from that advocacy level that's happening by the people who are, been in this for a long time, I see them, helping the government realize that we're going to experience a lot more challenges as it relates to infectious disease. And we're in it right now, right, with monkeypox. And so we have to figure out, what that means in terms of funding levels, so that we can really be prepared for the next thing after monkeypox, because there will be a next thing, right? So we have to make sure that we're prepared in that place. We're also going to be spending a lot more money in the next few years, in my opinion, on issues related to the long-term effects of COVID-19 and understanding that. We're also, in my opinion, going to be spending more money as it relates to the opioid addiction problem that we have in the United States, and also the connection between opioid addiction, mental health, and sexually transmitted infections, because that is an issue that has always been there, but because, in my opinion, it was impacting mostly Black and Brown people, those issues were never elevated to a level that they should have in order for the public health community to respond, in order for the funding to be there, in order for there to be an appropriate public health response. So I think that those are three of the biggest challenges that we're going to see over the next few years. I also think that we're going to need to see more infusion of dollars to make sure that we're diversifying the healthcare workforce. Right now we have, except for Asian communities, among all of the other racial ethnic minority populations, we see less than double-digit percentages of individuals in graduating from medical school and transitioning into positions as physicians throughout the country, right? That's problematic, especially when those populations represent more than 10% of the U.S. population. Matter of fact, minorities are, on track to be over 50% of the population in just another 20 to 40 years, right? So we have to make sure that we are diversifying our healthcare workforce, and not just physicians, but nurses, therapists, chiropractors, all of those positions need to see the diversity, nutritionists especially, but we definitely need to focus our energies on those roles where the individuals who are experiencing the worst health disparities, those healthcare roles that interface with those people more often than not. So when you think about people who have chronic health conditions, especially let's say obesity, we need to have more dietitians and nutritionists in that space. I think right now we're only at like 3% of them are African American. That's definitely not enough to address the issue. So we have to make sure that we're infusing more money into programs that already exist. Like, all of the states have a program where you get student loan forgiveness if you go and work in an underserved community. And all of the states have underserved communities, right? Right. And so we need to make sure that we have students ready and able to move into those roles so they can take advantage of that student loan forgiveness program. And also we need to see more medical schools doing things like making medical school free. And that's the way that's the only way we're going to get to that point in our country.
And doctor, that's a lot to digest. We could go on and on. We may need a part 2 of this. But I want you, if someone is listening and they want to get in contact with you and learn more about what you're doing, where should they go?
Absolutely. So I'll give you the email address for my company. The Mahogany Group is a public health consultancy firm, and we have a number of consultants who work with us in order to address needs that, crop up in communities where people reach out to us. And so you can reach me directly there at Eboni, EBONI, at theMahoganyGroup.com. You can also connect with us at www.theMahoganyGroup.com and see the types of services that we offer. And we are really excited to work with really anyone who has a genuine interest in improving health outcomes and reducing health disparities here in the United States as well as abroad.
Awesome. And obviously we will put that on the screen for viewers to see. And Doctor, thank you so much again for joining us today. It has been a blast.
Yes,
so much wisdom and knowledge in the public health space. So until next time, talk to you soon.
Sounds good. Thanks for having me.
Thank you.